Good morning to you and to Gisela, who is in the studio, and to all our audience in different places. We begin the briefing today with the good news that we had no deaths yesterday. 558 people are admitted to the country's hospitals, 13 are under surveillance, 300 are suspected, and 245 are confirmed. Our professional and specialists monitor 445 people in primary healthcare system due to epidemiological or clinical risks. Yesterday, 2,090 samples were processed in our country's molecular biology laboratories. In the Pedro Curie Institute of Tropical Medicine, 1,097. In the Ayamejedas Brother Hospital, 320. In the Epidemiology and Microbiology Labs of Santiago de Cuba, 288. In Villa Claras, 203. And at Havanas, 188. As a result of this study, the study of these samples, 14 people tested positive yesterday. Thus, Cuba has already studied 129,132 samples through molecular biology, and 2,233 people have tested positive for COVID-19. And that is 1.7% of all the samples studied. The 14 cases confirmed yesterday, they're all Cuban. This is something that has been happening for a while. 92.9%, that is 13 out of the 14 cases are confirmed case contacts. This is a primary risk group we have in our country, and it already accounts for 87.7% of all cases confirmed in Cuba are positive case contacts. That is 1,959 people. Yesterday, in one of the cases, the source of infection has not yet been determined, and we continue the studies to trace the source of infection. And in the cumulative total in the Cuban pandemic, 74 of the diagnosed cases, that is 33.3% of the confirmed cases, the source of the infection has not been identified. No cases diagnosed yesterday had a source of infection abroad. Thus, the number 159 remains unchanged. Of the 14 cases diagnosed yesterday, 12 are male, accumulating 1,128, 50.51% of all confirmed cases, and 2 of the cases were female, totaling 1,105 of the female 6, and that is 49.98%. And this data is important. 100% of the cases diagnosed yesterday, the 14 cases were asymptomatic, and this shows how we must not let our guard down. And we have explained this on several times, and these people may have developed some symptoms at a later stage, but at the moment they were diagnosed, when they are spreading the disease, they were asymptomatic. Of the cases diagnosed in Cuba, 1,189 people, 53.2% have been asymptomatic at the moment of the diagnosis. By age groups, of the 14 cases, 10 are from the 20 to 39 years of age group, 71.4%. 2 are of the 40 to 59 years, and 2 are from the group of 60 years and over. There were no children diagnosed yesterday, and we have a cumulative of 245 children who have been confirmed with the disease in our country, of whom 222, 90.6%, have been released. And this is an illustration of the favorable evolution of the disease in our country's children and the quality of their treatments. 100% of the cases belong to Havana province. Most of them are traced at a construction enterprise from La Lisa municipality, and it covers two municipalities, Habana del Este with one case and La Lisa with 13 cases. Thus, in the last 15 days, Havana remains with the highest rate of confirmed cases per every 100,000 inhabitants, with 9.84%. With the 14 cases confirmed yesterday, the rate is increased. Matanza follows in second place with a rate of 1.25. It is down from yesterday's rate, as well as Artemisa with a rate of 0.78. It also is down from the day before. The remaining 12 provinces and the special municipality of the Isle of Youth have not reported cases over the last 2 weeks. And I am referring to Ciego de Ávila, Granma, Pinar del Río, Mayabeque, Villa Clara, Cienfuegos, Santi Espíritus, Camagüey, Las Tunas, Holguín, Santiago de Cuba, Guantánamo, and the Isle of Youth Special Municipality. The incidence rate in our country currently stands at 1.99 per every 100,000 inhabitants. Of the 2,233 patients diagnosed with the disease in Cuba, 245 are admitted as active cases. Of them, 241 patients, and this is a favorable indicator, 98.3%, have a stable clinical condition. 84 people have died as a result of this disease in our country, for a lethality of 3.76%. And with this lethality, Cuba ranks at the 18th place among the countries of the region of the Americas. We always mention the two evacuees that were and yesterday there were 9 discharges, fewer discharges than the number of confirmed cases. Thus, 1,902 patients diagnosed with COVID in our country, 85.2%, have recovered and are currently being monitored at home or back to their normal activities. We are reporting today 4 cases in serious condition. All of them are from Havana. The one were reported yesterday at the Salvador Allende Hospital. 2 more patients added in that hospital, and another at the Dr. Luis Diaz Soto Military Hospital. As I said earlier, Cuba occupies the 18th place in the region in terms of lethality. The region lethality is of 5.41%, and on top, the 2 places with active cases are the United States, with 2,464,000 people diagnosed. It has already surpassed the 2 million mark and reports 112,924 deaths. In second place, Brazil follows with 772,416 confirmed cases and 29,680 deaths. Of the 35 countries of the region of Americas, there are 10 with a lethality rate higher than the region's average, which is 5.41. And as of 12 o'clock last night, the same 185 countries of the world continued reporting cases of COVID-19, totaling 7,343,562 confirmed cases. In a single day, 133,100 cases, which is a very high number despite the evolution of the disease. And 5,235 people died in the world due to COVID-19, totaling 416,430 deaths for a lethality of 5.67%. This means that for every 100 people who get sick with COVID-19, almost 6 die. In the region of the Americas, which already accounts for 48.54% of the total cases in the world, diagnosed 76,277 cases yesterday, totaling 3,564,507 confirmed cases, 3,583 people died yesterday, accumulating 192,883 people for a lethality of 5.41%. And this is information we had to report. I think that the Roundtable TV program yesterday, led by our president and with our prime minister and the Minister of Economy, Deputy Prime Minister Alejandro, it was very enlightening. It answered many of the questions that have been asked in our country in relation to the different phases and how the country will be incorporated, will be returning to normality, and how those measures will be informed. The phases will be implemented gradually and not in unison in all the territories of our country. The measures of what we call the post-COVID phase will be put into practice when a group of indicators are met in Cuba and in all the provinces.